Trust is the oxygen of public health, and nowhere is that more visible than in clinical trials. We're Sciana Cohort 7, Mridul Agrawal, Raquel Correa, Judith Dios, Claudia Schad, and Andreas Welker, exploring how to rebuild trust in health communication and make clinical research more accessible. Today, we're speaking with a clinical trials expert from the VFA about Germany's strengths and blind spots. Many trial sites, but no truly patient-friendly way to find them. High willingness, but too little information. Motivated doctors, but limited digital tools. We're asking, how can Germany move from fragmented access to a system where patients, clinicians, and communities can actually find, understand, and trust clinical trials?
Could you tell us what brought you into the role you hold now and what is involved in your role?
I work for an association, so we are not conducting our own clinical trials, so we work for our member companies. And I get in touch with the topic of clinical trials when I was at a biotech company. In the beginning, in a small biotech company, they needed people to work in the field of clinical trials, and I did it. And then we had this biotech bubble breaking. And then I was looking for a new opportunity, and I took up with the VFA. And originally I planned for just to be there for some years, but I stayed now nearly 20 years because it's quite interesting, because you work not only for one company, you have an overarching approach. And I think that's what I like.
Yes.
And work with different colleagues. So that's what I think is good.
Okay, could you perhaps also, for the other parts of our group who are from Switzerland and from UK, explain how patients in our country, in Germany, typically find out about studies and how they get involved in clinical trials?
The major role, in Germany, we have the problem that we don't have a good portal where patients which have no medical knowledge really easily can find a clinical trial. And I think that's why the doctors play such an important role. Mm-hmm. But you see also other approaches. So you have some portals like ClinLife, for example, where you have some kind of a matching, or Uvando, where you have some kind of matching tools for cancer patients. You see sometimes that doctor associations hold their own registry for ongoing clinical trials, like the Association of Urology Oncology in Germany. Or you see that patient organizations have a knowledge of running of ongoing clinical trials, and they try to bring patients and the trial together. So it's quite diverse. And that's, on the other hand, doesn't make it so easy, so to say, for patients to really find a trial when they are sick. They get a shocking diagnosis and then they are trying to find a trial. That's something what is quite a challenge.
If you compare us, Germany, to other countries, and you already mentioned that we have a problem, how do you think we are doing as a country in comparison to others? Are we good at initiating trials and including people, or do we have a problem there?
Some problems in other countries you don't have in Germany, because you have a quite distribution of trial sites throughout the country, and you have really a huge number of trial sites. So the way to potentially have a site not so far from the possibilities that you don't have to travel so far for a trial site is quite high in Germany, so which is an advantage. On the other hand, and that's sometimes a challenge for the sponsors, because you don't have these large centers, not like in Poland, for example, you really have just some few centers where patients really are accumulating, and then you have one site with a lot of patients. Here in Germany, we have the problem. So it's ups and downs, like everywhere.
If we look at the patients as a group, and if you look at who takes part in trials and who doesn't, do you have data or do you have knowledge about particular groups or genders, cultures that engage more or less in clinical trials?
We have done a survey in 2024 together with another association, and it was a broader survey. What you can see there that, especially when you look at the people from 40 onwards, they are a little bit more open for trials. The younger patients, especially under 30, are a little bit more reluctant, which is somehow understandable. But you can't really see what we did see in the survey, that you don't really have a gender gap, for example. So I think
Mhm.
the basic willingness to take part in the clinical trial for women was around 43% and for men was 47%. So that's nearly on a same level. And the survey did look quite extensively into different areas, also in educational
Mhm.
background of the people who were answering. And there you did see that people who are a little bit more educated are a little bit more, just a little bit, but nevertheless, more likely to take part in the clinical or more open to take part in the clinical trial. So it's a little bit like it's a mixed picture, but it's not like a big riff where you can say, oh, this group.
Mhm.
So that's something what you can't see from the survey.
Okay. So even if we are talking about like language barriers or something else,
Yeah.
I could.
Yeah, I mean, you address a certain topic, but you see on the other hand that a lot of sponsors, because they would like to have patients in their trials, that they at least offer some kind of ICF in different languages,
Mhm.
trying to bring translators into the discussions. So you see quite a diverse picture in this regard. And I mean, we are all aware that we need to also address this. And I mean, you can see this, for example, currently in Berlin. You have a campaign trying to, in the end, inform about clinical trials. They are doing it in German and in Turkish here in Berlin. So, because you have a quite huge Turkish community here in Berlin, and I think that's quite
See.
good, and that's why a lot of sponsors are also offering it.
You said something about like the age groups are somewhat different for younger people, for
A little bit.
example. And do you know why? What are the causes for the hesitancy in some of the groups?
I mean, I think it's quite natural. As a younger person, you are not. I mean, it's I don't know how it's for you, but when I was young, I was not really sick so many times. But now, I mean, sometimes you're getting older, you're getting more sick. So I think they are a little bit more distant to this topic of clinical trials. I think when you're getting older, you are more open because you see that this is an opportunity potentially when you have a severe illness. And I mean,
Mhm.
that's something what our survey also discovered, that I mean, the huge driver for taking part in a clinical trial is the hope for a better therapy or a chance when you have a untreatable condition, but
I
also
see.
the promise of medical progression. That's also something what people are seeing when they are in the end thinking about taking part in the clinical trial. And it's not, I mean, it's not that side effects are the main stumbling stone for participating in
Mhm.
the clinical trial. But in the end, the other drivers, hope for a better therapy, chance for an untreatable condition, or the hope for medical progression. This is these topics are all over 40%, when I remember correctly. So that's
Yeah, I see.
quite good to see that there's some kind of an openness, but there's a lack of information about ongoing clinical trials.
Mhm. We already touched on that subject, like databases and else. How would you, if you could change the system, like change legislation or change the approach to that, what would be your ideas how to get rid of these hindrances? What would benefit?
We need a good register for ongoing clinical trials in Germany. We have this German register for clinical trials, but this is not patient friendly. This is not easy to use and so on. So my wish would be that the German health ministry and, for example, the German NCA, so BfArMPI, take up like in Spain, and create a register which is in the end based on CTIS. As now looking, I mean, I'm coming from a pharmaceutical company who in the end are doing clinical trials with medicines, and they are all in CTIS. And I think this is a good repository for, in the end, have a good basis to have a register for all ongoing trials. And Spain is doing this quite well. They have a really good register in this regard. Um, and I would like to see something similar in Germany.
Do you know why Spain started this or what was the cornerstone? Why did they implement this?
Spain is currently the number one spot when you look at the number of ongoing clinical trials. And
Okay.
before, in the financial crisis, Spain in the end, already in 2016, identified that clinical trials could be one economic element where they should be stronger. And they really adjusted a lot of things in Spain. And one of the processes was just registered. And I think that's really why they did have a good position in the current. There are a lot of reasons, but I think this register is one of the reasons.
And we also look like we are also doing like a historical view. And in some countries, trial hesitancy or is sometimes fueled by historic events like things gone wrong or just narratives of things gone wrong. For Germany, do you know, are there groups that are hesitant to take part because they fear something might happen to them?
I would say that there is a lot of missing information on clinical trials. I mean, if you look at education in the schools, the topic of clinical trials is never addressed anywhere. And I think we need, and I think that's why it's good that we have, I mentioned this campaign here in Berlin, but there's also starting up a new campaign, Studienwirken, in Germany, which in the end will try to inform the broader public on clinical trials and really on the basis of clinical trials. And I think that's something we need to keep in mind. So we need to really inform better about it and really bring the topic of clinical trials into the broader public. But it's not only a problem for the broader public, it's also a problem in the medicine education, so at the universities, because in the doctor's education, the topic of clinical trial is never on the menu, so to say. We talk, and there are a lot of discussions now going on how to include also the topic of clinical trial in the medical education. And I think that would be also quite important.
Doctors are a valuable source for getting patients into clinical trials. And what could also be possibilities to tell doctors more so that they can inform their patients better? Are there initiatives on that, for example?
The easiest way to, in the end, include also a local physician to, in the end, be able to get in touch with clinical trials or bring a patient to a clinical trial would be that this software in the doctor premises would include an information. So I type in a new indication for my patient, and there's a pop-up. Oh, there's a clinical trial. You want to think about to also send this patient to a clinical trial. So this would be. But all this software companies are currently not really having the possibility to include this. And I think this would be really crucial to really improve the number of patients in clinical trials in Germany, because this could be really an important step, because we see that the doctors really play an important role, because patients often listen to their doctor and try to, and when the doctor is positive about the clinical trial, they are more likely to be part in the clinical trial. So that's why I think it's really crucial to really include the doctors here in this regard.
Let's change the subject a bit and focus a bit on social media and the narratives about clinical trials. Do you think there's also a potential for changing the approach to clinical trials?
Sure. And that's why this campaign Studienwirken, which will be starting, will also have a huge part on social media, because I think that's important. I mean, we as an association are in social media now and trying to bring information on different topics and health topics, because I mean, we all know that social media is so important currently. And so you have to be somehow in social media. But on the other hand, I think it's also important that patient associations are in the end active in social media. I mean, you have this, for example, Yes We Cancer. They are quite a social media campaign here in Germany in regards to oncology. And I think it's really important that these institutions, patients, organizations are in the end also involved in this topic.
Are there other factors we just didn't touch on, like where you would say, okay, I could change everything in the system? These are important factors that also could help us to get more people. Like there is a willingness, but there might be a gap in really taking part. What could be another stone to the pathway to get more people enrolled?
Again, I think it's really all about information.
Okay.
I mean, when you have a repository, then you have a lot of possibilities. The patient, a group that could in the end take this information and inform about the ongoing trial. Could be the possibility to have this repository and do this link to this doctor softwares in the local premises, so that you really have this. I mean, you need some kind of a repository to send this information. That's why we need something like this. And I think this would be really a huge step forward about clinical trials. Get more information about clinical trials. Also, for example, in the biology lessons in the school, why not talk about medical approaches, raise health literacy in many regards, and also talk about clinical trials. And I think that would be really important to really have a huge step forward.
In the current legislation, do you see already changes like that we are trying to adopt parts of the Spanish policy, or
Germany has done a lot in the last 2 years. I mean, with this Medical Research Act, they have in the end addressed a lot of problems we had here in Germany. For example, they have shortened timelines. They have allowed English signing of investigational medicinal products. They have introduced a strengthening of the system of ethics committees. They have introduced, which is a huge step, the problems we had for many, many years in regards to radiation protections when it comes to clinical trials. They have solved this. And they have introduced, just in December last year, this standard contracts for contract clauses for clinical trials. I think this all are really important steps, because Germany had the problem that we took too much time to have the first patient in a clinical trial. And I think this will speeding up the whole system in Germany, especially this standard contract clauses. And I really hope that we will see a positive outcome of this. And I can only say we also do surveys together with CRO organizations. And we see quite a positive trend in the view on Germany, because a lot is happening in Germany currently. And I see that there's a lot of improvements.
You mentioned the survey, and I was wondering, when I looked at it, are you planning on redoing it, like comparing changes and seeing where it leads?
We thought about it, but as I said, there's now this new campaign, and one of the leading supporters, and they will be doing similar approaches within the campaign.
I see.
We potentially will not do it on our own, but it will be in parts from run within this campaign.
Are there other comments or other data you want to refer to, like something we didn't touch as a subject at the moment?
We talked about the main focus is the recruitment, and I think that's the main element. As an association, we would like to see a lot of improvements in regards to clinical trials to really strengthen Germany as a trial location. The huge problem we have now, but it's not only in Germany, it's the personal crisis for the university clinics, for the doctors. We have too few trial nurses and so on. So we really need to step up this professional area in regards to really improve the possibility also to conduct clinical trials, because we really need more people and more hands on deck to, in the end, do clinical trials. But also Germany needs to get better in regards to digitalization. Look at this electronic patient document. I mean, it's really 25 years it took Germany to implement a digital patient card on your health insurance. And you really see that in a lot of, especially university clinics, the investments in digitalizations are not enough. We really need to improve this. And for sure, we need to talk about in Germany our federal system, because we see a lot of problems in regards to, we have a high number of ethics committees. We have many different data protection offices. We need to really be stronger in harmonization. And I think that's really something what we need to do here in Germany as a trial location if we want to do better. And other countries have done it. So I mentioned Spain. Look at Denmark with their trial nation approach, which is really great. So we see that there could be a lot of improvements.
Thank you very much for your time.